really where I live. That's my wheelhouse.
Right. But you also did, which I thought was really, to me, meant a lot. You worked with folks that had, like, I want to say, been intubated or health, where they could not eat, and then they had to learn how to. We talked about that before. Yeah.
So
that's a part. Yeah.
Yes. Sorry. So part of.
I think that's fascinating.
Yeah. In speech pathology. Speech pathology is this huge, broad field that covers every disorder of communication from birth to death. So that includes child language development, which is what a lot of people think of when they think speech pathology. It includes cognition. It includes voice. It also includes swallow, or dysphagia is the word for swallowing issues. And many voice therapists are also swallow specialists because it's the same mechanism. The most primitive function of your larynx is to protect your airway for swallowing.
Right.
So early on in my career, when I was training in my fellowship, I did a lot of swallow therapy. When I went to work in Orlando, and I worked for the medical practice that Disney and Universal would send all their performers to, one of the things I did there was they had a program where we made sure that we did swallow rehab all through radiation for laryngeal cancer, because we would do a pre-radiation check on their swallow. We do a post-check on their swallow, but during radiation, I think the story I was telling you that I often talk about is, we take this for granted. We always think, well, voice and swallow just happens. It doesn't. It's muscle and tissue. It works in a certain way. And, there were patients who, they'd be going through radiation for the throat, which can get very uncomfortable for eating purposes, and they'd want to go on a feeding tube. So they go on a feeding tube, they wouldn't eat for several weeks, and then the radiation treatment would be over, and they want the feeding tube out, and they want to eat again, and the swallow doesn't work.
Yeah, it's scary.
It is. It's very scary. But, the good news is we have rehabilitation for that. We have exercises. We have treatment. So, so my job was to make sure that these patients kept eating. I used to say, you're not eating for enjoyment. You're eating for exercise.
Right. And what you taught me is sometimes you need to chew smaller bites.
Yes, well, we talked about swallow safety.
Yes,
Small bites, single sips.
Yeah.
That's what my my supervisors when I was in Boston as a student used to tell me.
Right. It's just, I wanted to talk about, I don't think people realize this this is like so many muscles, so many things in here, and a lot can go right and a lot can go wrong.
Yes.
And it's just as, like, people do PT for other parts of their body, but we have no concept of how many parts are in here to work on. And I guess I want to ask, first off, I want to tell you, I saw a video where you sang at your back specialist.
Oh, yes.
But it was wonderful because I said, oh, I would have loved to seen you on stage, like, perform a role, because I could just really feel you, communicating the song, and it was beautiful.
Thank you.
But, and I guess I would like you to speak to, I guess I'll jump to it. How do you work? You've worked with so many people, and of course you work with performers, so they have an objective of, like, I got to be able to do this. This is my living. Mine was a little different. I don't know what happened or how I got to where my voice was, but I guess, how do you, there's so many different people, we've talked about it in the room, not as this kind of stuff, how people get and receive the information to help them work on getting their voice whole and well again, because you said, oh, I can give you this exercise, but it might not be, and or you said to me, oh, you got all of these. Most people only one speaks to them,
Right.
So how, and then you have people that must emotionally break down,
Yes.
you have, how does a person like you manage that, and how do you navigate the waters, and how do you start, or where do you find the germ to?
Sure. So what's interesting and exciting, but also extremely difficult, is that every patient is so unique, presents their own challenges, and has their own learning styles. And most people, even professional singers, don't always get the voice or what's happening. No one, no one really ever teaches you how to use your voice.
Kind of magic in here.
Well, I always say, it's not magic, it's muscle and tissue.
But for people in their they
Right.
have no clue.
Well, my patient before I came here tonight said to me, I've never had to think about this. It just happens. No one thinks about how they breathe. No one thinks about where they feel their voice. But it is a system of muscles and tissue and acoustics and aerodynamics
And
that make
different
this all
spots you
work.
don't even realize your sound is
Yes.
coming out of it.
So with each patient, my role is, it's part science and part art. I sit with someone, I get to know them a little bit, I really watch how they use their voice for speaking, for singing, for whatever it is they use their voice for voiceovers, for teaching, for fitness instructing, anything they use their voice. I watch them, I watch how they use their body, I listen to the sounds. When you speak to me, I see inside. I can sort of see what you're doing with my experience. And then it's, well, how do I reach that person and how do I get them? Because all I have to do is reposture you, basically. How do I get them to feel that? How do I get them to experience that? And everyone's very different.
Or visualize it. Yeah.
Well, so there are sensory approaches, which is probably the most common about, where do you feel the sound of the voice? There are auditory approaches, there are visual approaches, there are kinesthetic approaches, there's movement approaches, there's breathing approaches, and what I tend to do is, I would say I like to throw a lot of pasta against the wall and see what sticks. And I just got to find that one, which I think is what you're referring to, I got to find that one in to how that person thinks about their voice and how then I can use that to change what they're doing. And truthfully, I mean, I'm not to pat myself on the back, but it's a bit of an art form. And I never know, just because I see the diagnosis on paper, what a patient's going to respond to. There are times certain diagnoses respond to certain exercises and whatnot, but I've been surprised before. I think what you're referring to is probably in our evaluation, I said, oh, great, you respond to all these different things. I could go this approach, that approach, that approach. One of my favorite approaches is a very anatomical approach, which we did a little bit, where, I try to say, okay, here's how your vocal cords come together. It can come together like this or like this. Or we can, grind the voice like this. Or we can constrict it, with what we call the false vocal folds
Right.
above. So there's so many ways to work with a patient, and I try to come with a lot of tools in my toolbox and see what works for them.
And it's kind of like improv, because you have to improvise with the person, to figure out what's going to work. I mean, you have to just try things and hope that they're willingly going to come
so
along.
it's funny that you say that, because I've always wanted to talk about this. I've never put this talk together. There are two things that I think, well, there are more than two things, but two things in this context that I think I bring to the table as a voice therapist. One is, in my acting training, a lot of my acting training in Northwestern was based in Meisner.
Yeah, we talked about this
Yes.
because I studied Meisner.
So Meisner was all about, okay, repeat, notice things, and I think as a therapist, I mean, that's what I do. I sit, I watch the person, I
Mimic words.
sort of mirror back to them.
Right.
Patients will be like, you're the only person who's ever kind of mimicked me back to myself. And I feel like that's my job, is to point out, and with that, you mentioned the psychology piece.
Mm-hmm.
This is an emotional mechanism. They say the eyes are the windows to the soul. This is the window to your emotions. And
I mean, when you say that right now, it hits me. Sometimes people have a loss. They can stop talking. They
Yeah.
can't talk. Or they
Well,
have something happen and,
yeah, I'm
trauma.
all choked up, or I'm so afraid I can't speak. So, with Meisner, it's all about that repeating back. So I feel like I bring that to the table. And then I also had studied improv with Second City and Upright Citizens Brigade, and I participated in improv. And when I was a stand-up, the stand-up comics used to say to me, oh, you're an actor. How does that work? I always wanted to get into acting. And I used to say, it's the same thing. In stand-up, your audience is your scene partner.
Right.
And in acting, you have your scene partner. And my best comedy was not my material. My best comedy was when I just listened to the audience and I responded to them. It's like our interview right now. I don't know what you're going to ask me. I'm listening
Right.
to you. I'm responding, and that's what it is. And I think in voice therapy, it's the same thing. And I always say to my patients, come to my playground. Just come play with me.
Okay, so I'm going to ask you,
Yeah.
can you stay a few more minutes?
Yes, of
Because
course.
we'll do a little more, and we'll be right back. More with Scott.